Very good evening, good afternoon, probably good morning for some of you. So, I welcome all of you to this Ask Me Anything session or Emma session on dental genetics and clinical research. So, this is a very interesting thing that I always speak about, and I really love to do so. So, as time passes by, and I put up about dental genetics a lot, as many of you might know. So I get a lot of questions from different people, like from students or early career researchers, from both dental as well as life sciences. So today I thought that, I generally answer them through messages. But then I thought that it's a good idea to bring up those questions and, just tell the answers right over here and share my insights with all of you, and as well as learn from your sharings as well. So basically, we are launching a program, the fellowship program in dental genetics and clinical research. Probably you would have seen some shorts and you have seen the graduation program we recently did. So with all that things, I know that there are a lot of questions that runs in mind when it comes to this particular area of dentistry. So before I get into the question and answers, I would also like to mention that if you have any questions in mind, please feel free to put it up in the live chat and I will definitely take it up. Well, so, dental genetics and clinical research sounds very flashy, kind of interesting, but probably it is something which seems like not related to typical dentistry. Let me tell you something. Well, dental genetics is not new, neither is clinical research. We, as dental professionals, actually, when we are inside the clinics, when you are dealing with a patient, you are actually inside things, you are dealing with all these things. Probably, we focus more on the technical aspects, like when we do dentistry, the technical dentistry, I mean to say the clinical procedures in particular. So, we are more focused on that, and this is more of a holistic way of looking into a thing. So dental genetics, as I said, is not new, and it is a default system that we are born with, and we cannot deny the fact. Now the question is that why should we even try to delve into this, and why should we even take a guided path through a course or any kind of things like that? Well, when it comes to clinical research, or research for that matter, if you see, as a dentist, when you were a student or when you have passed out or you have become a specialist in the field of dentistry, so if you see, in every aspect, we are already searching something. Each case, each patient, each day is a challenge for us. It is not that we know everything about the patient. We decide and we deduct conclusions out of certain clinical visibilities and probably certain adjunct additional tests. Now, as we all know, that most of the time we have to do kind of hit and trial. Let's accept the fact. But yes, definitely, and clinician's eye is a clinician's eye, we cannot deny the fact. But then what is that we are missing out when we are just looking at the surface level? You see, let's take the most common example, oral cancer, right? Or rather, before going into oral cancer, let's say any lesion of the mouth. So as a clinician, when you are seeing it, what you have to do, I mean, what rather the question would be, what you can do, you can only do to relieve the symptoms or try to get into more definitive diagnosis. So just imagine and you know gain your visibility inside your thoughts, that is there a way today to understand whether a pre-malignant lesion is going to become a cancer or not? Yes, I know gold standard is biopsy. I'm not talking about that. We all know that biopsy is always not the choice, because we cannot do it on repeated basis and blah blah blah. We have a lot of disadvantages, and but still biopsy is something which we have to do because that is what we have today. A lot of adjuncts are coming, but still we lack something which is kind of like What if I would have known what's going inside? What's that going inside under the tissue? Well, now you will tell that, okay, then biopsy gives us the in tissue experience when you see under the microscope. So probably that is true. Definitely that is true. But then there are a lot of question marks there, because again, it depends on the eye through which the microscope is being viewed. I mean, the slide is being viewed. So again, there are a lot of sections that remains unclear, and out of everything, all that junks together, we come to a conclusion, and based on that, we are planning a treatment. What if I tell you that in today's date, we can understand even before a symptom appears, we can understand probably what is going wrong? Well, I also agree to the fact that the way I am putting it out, it's not so, point to point solution, but we have a solution probably on a mass scale. In the field of dental profession, we are not being aware because we are not exposed to this kind of knowledge. Second, we are not using it, we are not trying it. Let me tell you another thing. This is about cancer and stuff, and okay, fine, very simple things. Dental caries, right, we all know, is the most common disease globally. And this is a bread and butter of a dentist, if I put it in a very, very crude way. So have you noticed a pattern of dental caries in, like, a daughter, if you're treating a child patient, probably if you see the mother. And probably I would more focus on into I'll take my focus to gum disease, periodontitis or gingivitis, whatever, periodontitis. You will see, you will find, definitely find a pattern. This is not something which I am just telling. Probably you, as dental professionals who are working inside the clinics day in and day on, day out, would know more than me. But then I have had this experience. A very near brother of mine, when I saw that he's a young guy. I mean, he was a teenager that time. But I saw a similar pattern of tooth recession in his entire maternal side. His mother, I mean, mother, sister, kind of things like that. So these are the scenarios we have. Another aspect that I want to highlight is about the most sorted, you know, technique of treatment in dentistry is implant. It's the technique, right? So either we all want to get trained into it. It's a very good thing because it gives a very good solution to the patient in terms of long term, in long term, right? But have you heard of cases of implants which fails? Now, when an implant fail, it is not the just that the clinician who is doing is at fault. There are a lot of aspects that depends on the success of an implant. I'm not going into all those details. I'm just trying to give you the common things that happens inside dentistry. What if we have a mechanism, if we can really know about all these things? First thing. Second, what if we can innovate ourselves by looking into real people, that is collecting evidence, and then trying out certain things which are under the, I mean within the coverage of our ethical periphery, and we deduce a conclusion out of those kind of cases and tell to the scientific community through publication. So how good thing would this be? Now, what all things I told you is nothing but the background comes under dental genetics and clinical research. And that, if you do it by case and you study it well, it is nothing but evidence based approach. And the the point that I started at the beginning, that can we know about symptoms, even, I mean, about the underlying problem even before symptoms appear? That is very much possible. I'm not telling for every case, but yes, it is possible. And it is not something that we need to go out in the world to search for such solutions. If we are yeah, then we do have a lot of solutions like that. The point is, we just need to see what it is. So with all these things in mind, and there are a lot of unresolved common questions that still exist in dentistry, which you many things cannot be solely answered based on clinical derivations. Like I already told you certain things. Another thing is a common thing, like you give some medications, or you see a tooth eruption pattern. So it differs from very people to people, individual to individual. Why is that? Because dental development, tooth development mechanism is same for everybody. For example, you treat a patient with a certain kind of drug. One patient responds to it very well, other patient doesn't respond to it at all. Another group of patient might be kind of, they get diverse effects due to it. Why is this? Again, you will see, which comes to getting oral lesions, or maybe you are using certain dental materials. For that also, some people have allergic tendencies, or probably any other kind of things, which is not it is very difficult to explain and solve at that point of time. Also, if you see that, um, as I said, like periodontal disease or kind of stuff, like how exactly this disease is progressing, or what is making a person more susceptible to a certain kind of oral condition. I'm talking about pathological, and the other person is not becoming. So I think all the keys to these answers questions, the key lies in dental genetics, because it's very important that we take a holistic approach, and it's time. I mean, we cannot be just blind, because the entire human genome, or our DNA, has been deciphered by that by this time. The knowledge is out. As dentist, or as a community in the medicine, in the healthcare, we cannot just be blind and remain isolated. Well, so with all these concepts together, I would like to really tell you about our course, and I will tell you that why this is important. Because definitely, we are hosting a course, we will tell it is very good. Actually, my perspective is not like that. You can really trust on my words, because I have been in this field for the past 9 years, probably 24 would be my 10th year, to establish dental genetics as a significant field of study in India as well as abroad. Well, in Western countries, still we have exposure interdisciplinary, but in India, we need to think a bit more, and it is a very good time, because we can do a lot of things now. We have a lot of scopes now with technology, with funding, and other stuffs, because we are getting exposed to many things now. So quickly, I will show you the course, and I will tell you that how it is designed. So when you open up our website, that is www.genedent.com, you will see this homepage. And the first thing that you see is the Fellowship in Dental Genetics and Clinical Research version 2, in a sense that this is the second version that we are starting, and we recently completed the version 1. And you can see all the testimonials that we have from our fantastic participants. And this is the 26 weeks online course, and it is accredited by the American Council of Training and Development, New Jersey, USA. Let me specify, this accreditation makes the our certification globally acceptable, but there is no CDE or kind of points associated with it. So this fellowship will help you in diverse ways. So you can see all the details here. If you are looking for academic research, it will help you. If you are going to try your hands typically in the industry into clinical research, it will help you. If you are going to try your hands in careers like scientific writing, regulatory affairs, pharmacovigilance, this will help you. And if you are an existing clinician, or somebody who wants to set up your own clinic, futuristic diagnostics is something which is a main part in this course, which will help you make your practice stand out than the common dental practice that is happening all around. So we have divided the modules in on a weekly basis, and this is self-paced in a sense that you can watch it in your own time. Every week, we will be providing the necessary video lessons that will be you can study at your own pace and time. So as you can see that right from ABCD, we move ahead, and then we also tell you how you can apply this knowledge in different aspects. Again, as I said, I would like to mention that this is not theoretical. This entire course is an application based uh, course. And once you come inside, you will understand this is not just that I am trying to make a promotional statement here to excite you about the course, but I am telling what is what. So, um, then we also, I just want to show you that it is not only about teaching you something about the subject per se, but we will help you to make you independent as a person. Like, we also have capstone projects where you will be writing your own research proposal. It is not mandatory that you will have to do the research, but that's kind of a demo project that you will be doing. We will in a specific module, like probably this one and also this one, we will tell you how exactly you can delve into the industry and explore many career options which are existing, where other discipline medicine people are there, but we are not still so much there. I mean, I always feel, why not? We should be there, because we are not away from medicine. We are very much a part of the human body, dealing with the most intricate part. So this is the course all about, and you can check through it. And also, this is, as I said, it is a self-paced learning, as well as you will have a, live session activities where we can interact with each other. Else also, we will be providing with you live activity sessions, and if you cannot attend them, you will also get a recording out of it. So it's a very didactic program, and we have thought about 3 4 aspects in which you can enhance your knowledge, apply that knowledge, and you can become a better person altogether, in terms of the skills that you require, even to go out in the industry and search for a job, or modifying yourself, standing, making your CV stand out, or whatever is needed. Further, if you want to go ahead more, and if you have an intention to go abroad and take up more higher studies, whether it would be some MS courses or PhD, this would be the perfect course which will act as a bridge, and it will give you the insights that is required to go and stand out there and pursue the dream career that you want. Also, this is a course where early researchers can come in, and you can excel in your academic research career. If you are already an academician, this will help you, and it will help you to simplify the process of research writing, writing grants, bringing funds, because that's all about, at the end of the day, we need to bring funds, we need to go do good research, we need money. So all these things are very much well compacted inside this program, and I invite all of you to attend this program. As well as, I would also like to say that we have an opportunity of providing scholarship in this program once you enroll. Also, we have an option, if you want to go for a EMI payment option, we have 0% interest free EMI option, and you can contact our team. In that case, you can go into the website and you can find all the details. And the Croiner scholarship, the is something which we have done last time as well, and this time we have something more to offer, because this scholarship will be applicable to our other fellowship courses which are upcoming as well. So we it goes through as examination part, and that will be an interview part, and then once you are enrolled, only then you will be eligible to apply for the scholarship. And if and depending on your performance in the written exam as well as the interview, uh, we will, from our company, we will sponsor certain part of the program fees. So that will depend absolutely how you perform. So well, so that was all about today, and that is all about how we can use this power of dental genetics and clinical research to create a real impact, not only on ourselves, but we are going ahead to get good for the greater society. It is not future anymore, my dear friends. It is here. It is just that we need to open our eyes and see what is happening. and grab those things and put our feet everywhere. Because I personally feel that dentists should be in every team, in every medical team, in every interdisciplinary stream. But for that, we need to get ourselves skilled before even we try opportunities. So this guided path through our fellowship program will help you achieve all those things. And you can check for yourself. You don't have to believe what I am saying. You can come in and check for yourself, and you can also reach out to our other participants who have completed this program recently, and they have shared their experiences as well. So with that, I will wind up today. I don't see any questions here in the live chat, but still, if you will be watching this video later and if you find some questions coming to your mind, please write it down in the comments. I will be very happy to answer them. And I hope I will see you inside the fellowship program very soon, and we will meet very soon. Thank you. Good night. Have a good day for some people who are watching us from different parts of the world. Thank you. Bye bye. Take care.